Hey, welcome back. We are talking about the multifidi muscles and the lumbar erector muscles today, as well as the thoracolumbar fascia. So we're continuing on with our discussion of the cylinder. In each class, as we kind of go through some movements, and then as we start to bring you back to a reassessment of singing, it's not even that we expect there to be an actual phonatory change for some of these. However, when we do start really combining the entirety of our intrinsic system, that's when it's like, oh, wow, this is really, really important for our pressure management. So we're kind of breaking it down just to see and to feel and to sense into parts of this cylinder or parts of this canister, parts of this pressure system. And then we're gonna, on Friday, we're gonna kind of put it all together. So today we're talking about the stabilizers, the stabilization of our center of mass. So when I'm referring to a center of mass, we're talking about L4 and L5, the lowest portion of our lumbar spine, and then L5 and S1. So here's this sacrum of the pelvis, and then it has the ilium, the hip bones coming in and connecting at that SI joint. So we have that lumbar spine and the sacrum. So we have our center of mass is right down here. This is what we're referring to as our center of mass. And we're talking about stabilization of this area and stabilization of our spine. So let me share my, oh my goodness, okay. I have two tongue pulled up. Yes, we'll save that. Oh my goodness, okay. Where are you? There you are. Okay, sorry everyone. I have a lot of slides full of for this. Okay. All right. So today, once again, our disclaimer, just because this is a new video, not medical advice, just for informational purposes. And here's that pressure canister. So we just got done talking about the tongue, and I mentioned the mylohyoid diaphragm, and that's here in blue, this diaphragm here. And then we talked about the fascial connections down into that thoracic outlet. That's number 4, another diaphragm. So that superior thoracic aperture is that thoracic inlet outlet. So we're talking about there. We also mentioned briefly the soft palate up here, which we'll talk about on Friday. So even just today, we've heard about these 3 diaphragms. We've already covered in the cylinder class that respiratory diaphragm and the pelvic diaphragm here. So we're working through these diaphragms. And then on Friday, we talked about the transversus or transverse abdominis and the internal obliques. So those abdominal muscles. And now we're going to talk about some spinal muscles, really important. Again, it's part of that intrinsic stabilization subsystem. Many different names for this system. Most people know it as the inner core. And this is everything that's actually involved. And we're just kind of slowly making our way through here. So that intrinsic system responsible for building and managing our intra-abdominal pressure, as well as stabilizing our pelvis, our ribs, and our spine. And today we're looking at the multifidus muscle, or the multifidi. The multifidus is one singular, multifidi are the muscles as a whole and our spinal erectors. So over here on this left picture, they actually go all the way up the spine, but we're just looking at the lumbar portion and the intrinsic system. So that's why it's only drawn in this lower portion from the sacrum onto the spine. And so these muscles are within this deep system, the deepest muscular system of the spine are the multifidi here. And they're called the transversospinalis muscle group. So these muscles that are all here are grouped together and called the transversospinalis group. And within that, we have our multifidus muscle, or multifidi. So multifidi coming all the way up the spine. It's many of them. So here it's drawn, many of them kind of coming between 2 or 4 vertebrae to create what's known as intersegmental stabilization. And we look at the term multifidi or multifidus, and it is multiple. There are many multifidus within the multifidi, and connecting one vertebra from this process, the transverse process, up to the spinous process. So really important muscle structure here for that intersegmental stabilization. It is very commonly inhibited. And if someone has low back pain, you bet they have some inhibition in their multifidus. It's one of the #1 causes of there are a lot of causes of low back pain, but it's one of the #1. It is very likely that we have inhibition in our multifidus. It gets inhibited very easily, like our transverse abdominis and internal obliques. When it gets inhibited, often some people have inhibition on both sides. Many people have inhibition on one side or another. So a one-sided inhibition, which starts to rotate the lumbar spine slightly, because these are rotators, they rotate the spine to the opposite side. So they help to extend, they help to flex to the same side, and they help to rotate to the opposite side. And so what happens if one side gets inhibited, we no longer have this neutral kind of straight on spine, it starts to rotate a little bit. Well, the thing about motion in the lumbar spine, we have very limited motion in the lumbar spine. This area is truly meant for stabilization. The motion should come from our pelvis and should come from our thoracic spine. And if we are not having optimal motion of the thoracic spine and of the pelvis, the lumbar spine starts trying to take over for that motion. I think it's about 1 to 2 degrees of motion between each lumbar vertebra versus 3 to 4 within the thoracic. And then of course, the pelvis, the hips, the hip is extraordinarily mobile. So we're kind of the low back starts kind of taking on more mobility than it should be, and we start to lose some stabilization here. And then a lot of times with this muscle in particular, it starts to get inhibited, and particularly on one side, and then we start to experience back pain, low back pain. Oop. All right. So the lumbar erectors, I don't want to skip over those because they are part of this too. So then the lumbar erectors coming on up, a part of another muscle group of 3, and they're coming up, they're more superficial, so closer to the surface, and they cover more distance. So they're coming up all the way up as well, but again, we're focusing on the lumbar portion here. What can happen is something called synergistic dominance, meaning they're both part of the intrinsic system. And if a multifidus, or if the multifidi start to become inhibited, meaning they're not firing, they're not activating, or really, in truth, they're just not activating as much as they should be. They are activating, they're just not as much as it should be. These muscles, the lumbar erector muscles, start to become dominant. They start to take over, particularly on that one side, which is why a lot of us can experience, oh, I feel this line of pull or tension like a tent rod up one side of the spine, whether that's on the left side for some people, whether that's on the right side for some people. That's because the multifidus on that side have become inhibited and the erectors are taking over. What we need to do is get these multifidi firing for you or firing for us so that these lumbar erectors don't take over so much, so that that line of tension can start to dissipate, and so that we're not turned into a slightly rotated position and held there. So within this, a huge part of this area and of stabilization in this area is the fascia, the connective tissue, the thoracolumbar fascia. So thoracic spine, lumbar spine, thoracolumbar fascia. Really important, very dense tissue, connective tissue. It is formed by three laminae. The forward, the front, the most superficial, the most deep, the closest to the inner part, the closest to our organs, is made up of the transverse abdominis tendons and the internal oblique tendons. The middle layer is made up of the multifidus or multifidi and the erector spinae. And then the outer layer is made up of the gluteus maximus and of the latissimus dorsi. So this muscle is our lats, which we all know them as, our lats coming all the way up and connecting to the arm, which is why sometimes we can see someone might have to come outward with their arm if they lift them up and overhead. Maybe they have to start bending the elbow. Maybe they just don't have that full range of motion because these lats start to pull down. All these can start to get overactive. This whole system starts to kind of pull in. I'm just going to throw out that, and I think I've mentioned in another class, a lot of times when we're feeling stiffness, we are actually feeling something in our connective tissue. Our connective tissue is more highly innervated than our muscles. So when we're feeling that stiffness, definitely all of this stiff, if it's not painful in the low back, but it's like, I just feel stiff, it's the thoracolumbar fascia. Something is happening within this structure that, and often what's happening is that our transverse abdominis, internal obliques, and multifidi muscles have become inhibited, and we're not able to manage our gut pressure as optimally as we should be able to, or as we want to be able to. And therefore, this structure becomes stiff to try to stabilize the spine as much as possible, because our body's brilliant and it's going to try to stabilize where it needs stability. And then we start feeling the stiffness here. And then what can happen is this larger global muscle of the latissimus dorsi can start to compress into the back of the rib cage so that we don't have the full expansion that we need back in the back. So this is another structure, just like we talked about the rectus sheath in the front, where we need to be able to build and manage that pressure on the inside. This structure takes that building and management of our pressure and then sends it into the outside world through massive global movement here. Our largest muscles of the lower body being that gluteus maximus. These are technically the minimus muscles that are drawn here. Sorry about that. This is just a picture of the lat. But our gluteus maximus muscle down here, the largest muscle of the body and the largest muscle of our lower body, and then the latissimus dorsi, the largest muscle of our upper body, allowing for global movement, and especially that global movement of rotation. So through our rotational plane. But if those very important multifidi muscles are not firing, then the rotation that's occurring is not optimal. We have suboptimal rotation. Cool. Any questions? How cool is this? Like every time I dive into anatomy, I'm like, I mean, what? These little tiny muscles do this. This is incredible. It's just amazing. When the more I learn about the body, the more I'm always like, isn't it so cool? The body's just so cool. Okay. Well,